On today's episode of Dance Med Spotlight, I'm speaking with Alyssa Buffer. She is a Boston-based physical therapist, owner of her cash-based PT clinic, as well as the Artistic Athlete Health Collective. Between the two, she works with performing artists of a variety of types, a variety of locations, getting to work on-site, backstage, in the wings, at the schools, you name it, she is probably involved. This episode in particular, I feel like we talk a lot about some of the possibilities of where we can go in supporting dancers and performing artists in their health and wellness, and just making it a better experience as a whole for them. Make sure that you listen, see if you get some inspiration for some of the things that she's talking about so that we can continue to push the boundaries, change the culture, and continue to keep our performers happy and healthy throughout their careers. Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine and dance science. Today, I am super excited to have Alyssa Buffer, a physical therapist who specializes in treating performing artists. Welcome, Melissa.
Thank you, Alyssa. I'm thrilled to be here. Super thrilled.
So a few things that I know about Melissa. She is a dual business owner. She has a cash-based PT practice and is involved in an awesome organization called the Artistic Athlete Health Collective. We're going to talk a little bit about both of those, but you get an opportunity to work with a lot of different kinds of performing artists across different genres and settings and all kinds of things like that.
Yeah.
Tell me a little bit about what got you to this place of being a healthcare provider specializing in treating performers.
Awesome. Yeah. So I've been a PT now for almost 20 years. I went to Northeastern in Boston, where I still am. I've been a dancer my whole life. I'm trained in ballet and tap and jazz and modern and hip hop. And I did some point work for a few years in there, somehow survived that. Lots of musical theater growing up too. And so I've always been in the dance and theater world, since I can remember. And during PT school, we had an opportunity to do what is called the Midler year writing, which is a whole Northeastern thing. But essentially it was like a thesis. And so in researching that, I'm like, what do I want to spend a whole year? What topic do I want to spend a whole year with? I sort of then stumbled upon dance medicine as its own thing. And I had the luxury of being in Boston where, dance medicine sort of has some of its real original roots through Children's Hospital. And so I sort of got immersed in there, and in the research, I'm realizing I'm like quoting physicians that are about a mile away from where I was sitting. And so at Northeastern, we have a co-op program. And so my next rotation, I kind of wedged myself into an outpatient clinic that works right with, Children's Hospital and their dance medicine department. And so I, as a student, was like, all right, this is my thing.
Yeah.
When I was getting my master's, if that gives you, I just aged myself there. My master's in physical therapy. I applied to do a clinical rotation at Performing Arts Physical Therapy in New York, and got that rotation, and so spent my last clinical rotation, backstage and in the clinic, and really learned like, oh my God, this is a thing. Oh my, and the thrill in the theater was just like back in the theater, and certainly in a different context was awesome. And then I came back to Boston and started working for that company that I did the co-op for. And so I was starting to see dancers right in the clinic. And then pretty soon thereafter was contacted by NeuroTour, which, is the company that does all the traveling Broadway stuff. And so got my first Broadway gig, I don't know, 2 years out of school, and sort of became one of their go-tos for Boston. So, spent over 10 years working backstage for them. And then 2019, I was still working in the same outpatient clinic, was the manager at the time. And
Mhm.
for many reasons, it was the time for me to leave. And so at that point, I started my own practice. Buffer True North Physical Therapy and Wellness, that's myself and my husband is also a PT, and we've actually worked together for a really long time. So we already knew we can do that.
Yeah, that's awesome.
So I started a cash-based practice, and at the time, sort of stopped the contract work I was doing for that company and started to forge my own contracts with the local Boston theater scene.
Mhm.
So developed some relationships with theater companies and dance companies. And then the pandemic hit and everything got thrown in the air. And then as the dust sort of settled, about 2 years ago or so, I started the Artistic Athlete Health Collective, really sort of based out of necessity, in the sense that I
Mhm.
was getting a lot of great opportunities, but I'm just me. I have 2 kids, a husband, and a business, and I'm like, I cannot do it. So I started offloading some shifts to my friend leagues, PTs who
Mhm.
knew I could send out and they would do a good job. And then just, I guess the entrepreneurial side of me was like, wait a minute, this might be a business. And at that point, really just started the Artistic Athlete Health Collective, as a placeholder for those contracts, for those theater gigs. And, at first it was sort of attached to my cash practice.
Mhm.
But then not long thereafter, the product, so to speak, was so different than the in-house cash-based therapy that,
Yeah.
and I also wanted to expand it, and we sort of quickly realized we needed more help, and so in the aim of not just sending random clinicians into theaters, developed a mentorship program, uh,
Mhm.
collective. So, we can literally vet therapists and provide them with the skills that frankly I wish somebody provided me specifically. And it's not the hands-on skills, it's the trauma-informed care. And it's things that, outside of the hands-on manual stuff, although that's very important in the understanding of demand. I really outfitted this program with other clinicians. I very much outsourced most of it to the
Mhm.
experts who this is their thing. And so that was a really fun, eye-opening. And then I served as sort of the mentor, which was thrilling, super thrilling.
Mhm.
And that's sort of where we're at now. We have a bunch of contracts with area theaters, and so we're constantly, doing onboarding new productions and developing prevention plans with dance companies and theater companies, and have a great mentorship program. We've seen, 7 mentees go through the program, and they're all doing the thing. It's actually like one of these things I didn't anticipate to be such a thrilling part of this, but it turns out I just love it.
Yeah, that is awesome.
That's how I got here.
Yeah, and I mean, there's so many things that you talked about that I think are really interesting, especially also as an entrepreneur and as someone who is in a teaching role and things like that. Like so many things, it's like, yes, I understand these things for sure. And I think, th- with your company of Artistic Athlete Health Collective, um, is it all physical therapists? Do you have a mix of folks? Like, how do you
Yeah.
find that balance with supporting your performing artists?
Yeah. So we do have a number of therapists, PTs on staff.
Mhm.
We also have a few massage therapists that we work with.
Mhm.
I have, I mean, 2 physician groups that I can kind of call quickly to get
Yeah.
folks in and seen. We have, this was a hard person to find. And, we've been asked. So I finally found an RD who can go out and speak to dancers of different ages at studios. That's a request that we've gotten a few times. And um, it's been hard to nail an RD with that experience down here. So if you're out there, reach out to me, please. We've worked with some acupuncturists and chiropractors, and really my mission with this is to continue to open that. I have some strength coaches in there,
Mhm.
because, as physical therapists, we, kind of wear many hats, and we often can kind of do a lot of those things I mentioned.
Yeah.
Um, and also, it's important to me to continue to elevate any clinician who has the interest of reducing injuries in performing artists.
Mhm.
And by all means, there's amazing experts. I mean, we're in Boston here. It's like laden with amazing practitioners. So that's a really big part, not just the providing the artists the very curated care that they need, but also as like a community, right? I'm very
Mhm.
much of the like rising tides lifts all ships motto. And
Yeah.
so there's plenty of folks who need our help. The more we can kind of open up and cross refer and really prioritize the client's health and their needs over like our individual egos,
Mhm.
has been incredibly important to me throughout all of this too.
Yeah, I think, having that network of people, whether it's within a single company or people that you're able to refer out to, it helps get a variety of eyes on the person as well. Maybe there's somebody that they connect with a little bit better and open up to if things are happening.
Mhm.
We learn from one another. I know even every single episode of this that I do, I learn something from the person that I'm talking with.
Sure.
So, I mean, it's just there's so many opportunities for everybody involved when we're able to sort of branch out a little bit and have that network, whatever it looks like.
For sure, for sure. That is such a great point. I love that. Yeah.
Since you've been involved in the performing arts scene for basically your entire career, plus some training as a student, which is
Mhm.
amazing, by the way, getting to just have that entire time frame like that.
Mhm.
Um, what are some things that you are seeing? Let's maybe start with this kind of like theater aspect.
Mhm.
What are some things that you commonly see come up for the performers that you're working with,
Mhm.
whether that's specific injuries or other needs and support that they would benefit from?
Yeah, that's a great question. The theater scene to me is really, it's a little bit of like the canary in the coal mine, in the sense that, you know the theaters I work with here, I mean, most of the larger theaters, the regional theaters, are sort of base their productions on how Broadway does it. And what that is typically it's 8 shows within 6 days. So they have Mondays off,
Mhm.
that's it. And then often 2 shows Wednesdays, 2 shows on Saturdays, and a single show on the rest of the days. And it's I think that in itself is the basis of most of the injuries I see. And because as we know, most injuries in sports medicine happen under the state of fatigue.
Mhm.
Fatigue is often the common denominator, whether it's like localized muscular fatigue or sort of general body fatigue or life fatigue, emotional fatigue.
Yes.
Um, it is the common denominator to most injuries, right?
Mhm.
And there's no way any human with only 1 day off is well rested.
Yes.
And so again, the injuries vary greatly, depending on the production. Some productions are um, not even musicals; they're plays.
Mhm.
Sometimes they're on a rake stage, which is an angled stage, or things like puppetry will completely play a different, how we have to mitigate injuries.
Yeah.
Certainly, a lot of the productions have dance in them, so we're sort of dealing with the regular run of the mill dance injuries. And then, there's an interesting gray area in musical theater that a lot of folks who do musical theater, not every single one has a dance background, yet a lot of the productions have some dance in them.
Mhm.
And we have found that and this is the benefit of us, most of us having a dance background, is that oftentimes with folks who have a musical theater background and not a very strong dance background, but are being asked to dance with the dancers in the production, really have to learn, like, I almost want to call them hacks, how to move their body in ways that dancers innately develop over their years of training. But if you haven't gone through that process, it is not an innate skill. So, we kind of joke, like, sometimes I've called this the Book of Mormon syndrome. I've covered Book of Mormon a bunch of times. And there's a lot of that in that show. And so there's a lot of like fast shoulders and fast heads and, very quick movements that, dancers know how to do this type of thing quite efficiently. It's not about actually making your muscles shrug and release every single rep. Yet if you don't have that basis as a dancer, sometimes those movements don't land well on the body.
Yes.
And so we're like kind of teaching dance hacks often to minimize those types of injuries that sometimes will bubble up. And I'm sorry, Book of Mormon folks, I love you all. It's one of my favorite shows.
Well, and I think to that point, if you're not sort of developing over years with some of those dance specific skills, even something that I see like in the West Coast swing community, it's a lot of adults who go, hey, I want to go do something fun. Oh, there's a dance class. I'm going to go take it. And then they get sucked into the world of West Coast swing.
Right.
Something as simple as when you take a breath in movement or things like that, that we totally, we take advantage of all the time and don't even have to think about it if we've been trained over the years. But coming into it, it can make such a difference in how you move and how you feel in performance and all of that sort of thing. And I mean, that's just breathing, much less any other movement.
It's quite wild how breathing mechanics is one of the things that, regardless of the level of, I find that to be, it's shocking to me. I mean, it shouldn't be at this point, but how that is like one of the most common things that we have to retrain. And the fun part about working with, especially in a musical theater setting, is that they all have sense of diaphragm. It's a big part of vocal training and stage presence. And so when I'm like, actually, this is how we get into your core, and this is how we establish proper breathing mechanics, they're like, oh, I know that thing. I'm like, good, great. So we're jumping off something we already are familiar with. And so it's like a really great entry point for, like, they already kind of know it a bit.
Yeah, I always love when my dancers say, oh, yes, I also take vocal lessons. Like, all right, I know we have something that we can jump off of for sure.
Yeah, totally. I love that.
Another thing that you had mentioned at the beginning of this question was this whole idea of, with the theater performers doing their 8 shows in 6 days and knowing that one day off is not sufficient for someone to be truly like healthy and successful and operating at the top of their physical abilities and mental abilities and all of those sorts of things.
Right.
I think that brings us to kind of a bigger topic of just how performing artists are managing their health or not,
Right.
and how they're being supported in their health or not.
Yeah.
What other things do you have like that you can think of, some examples?
Yeah, I think this is to me, this question is the basis of, like, not to make it sound dramatic, but the rest of my career. Again, I mentioned I have the amazing luxury of being in Boston here with, like, some of the best dance medicine resources. And a few months ago, there was a children's hospital held this symposium, outlining a lot of the work they do with, and it was very much because it's children's. I mean, they work with Boston Ballet, and but they're affiliated with Boston Conservatory, and we have a Boston, one of the Boston public high schools is an arts high school, and so there's a lot of this wonderful collaboration amongst all these institutions, getting PTs on site in these studios and in the school setting and in the college setting and the conservatory setting. And it was amazing. And the thing that kept coming up to me throughout all of this, aside from like, this is fabulous, because they set it up in panels and it was multidisciplinary panels, really wonderful content. I was like, well, what happens when you're 26? And, because I really mostly work with adults. I occasionally see, teens and tweens, but most of our clients are adults or professionals at this level. And so it's to sort of answer your question. One of the things that, that I'm trying to create with this health collective is this type of collaborative network where it's not just, if, you're in a production or you're part of this dance company, but a real connected network of providers that not only just know each other and can like text or email each other with things, but like a real, more of a formal way for artists to enter into health and wellness in a way that like allows them to work with the providers that, best suits their styles and their needs. It's a lack. It's a real lack here, frankly. And we're in a big city. And so I imagine that we're not alone in that regard.
Mm-hmm.
And so, as part of the collective, we have did a whole year of weekly strength and conditioning classes. You and I know strength and conditioning is probably the most important element outside of dance to a dancer's health programming. And it was not well attended. I mean, and we offered it on a sliding scale. It was like a $5 class. So it wasn't really, and we tried noon and we did 5:30, and like we went through different studios, and just not well attended. And we did speak like, so the effort of trying to provide low to no cost information, I will keep doing it. Like, I am not going to slow down because the classes weren't full. That's okay. It's time. But I do think that there's a bit of a lack of not a really great bridge yet to get the information that we know, right? The research has been done. We know how to prevent or mitigate really most of the things that we see. It's for some reason just really hasn't penetrated the community as well as I would have hoped. And I know this is like, I've spoken with other clinicians in other cities, and this is kind of a common thing that we all complain about a little bit. And so I don't know if I've answered your question specifically, but I'm kind of lamenting with the lack of answer, so to speak.
I agree 100%. I mean, it's been a little while since I've done the math, but several years ago, I had just out of curiosity Googled dance studios near me. And I pulled up everything that's within, I don't know, like a 25-mile radius, something like that, something where you could probably drive it in about an hour. And this is only dance studios. It's not teams at schools. It's not professional companies. It's not any sort of, I think there were a few like Irish dance schools, but it was predominantly classical dance studios. And there were something like 60 some studios within 20, 25 miles of my office.
Wow.
And do you want to know how many of them I successfully get into on any basis, much less a regular basis?
Right.
And it's tough. And even being at some of the conventions and things, sometimes I have really great conversations with the dance teachers, the studio owners, that sort of thing. But actually getting it to go somewhere after that is a challenge because it is not part of the culture. It is not part of the history. And so I just keep hoping that if I keep showing up and being obnoxious about it, eventually someone will listen and it will start to change.
I mean, I definitely, again, the symposium focusing on children, like wonderful. Because to your point, getting into the studio environment where these sort of habits, so to speak, start and where the culture really begins is getting to the root of the problem in many ways. And, I have found that to not likewise to not be as successful. And I will say though, we've had a few ballet studios, very, self-identifying, we are a ballet studio, have reached out. And interestingly, I have a meeting with the director to get a sense of what their needs are. And I kind of went into these thinking it's going to kind of be, how do I improve my turnout? The biscuit to banana thing.
Mm-hmm.
And I was pleasantly surprised that the topics that they brought up revolved around fueling for their artists,
Yes.
about safe stretching techniques. This was awesome. Safe social media practices. I was like, yes, I will find somebody that can speak on that.
Yep.
So, I have actually been somewhat pleasantly surprised with some of the topics. I wish this was more. It's been maybe, I can count on one hand the studios that I've connected with and have provided this type of education and workshop. But yeah, and I think for me, because this is such a hard nut to crack, I have leaned into the professional companies and those that, in Boston, because of our proximity to New York, we have some amazing dancers and amazing performers here. And the dance companies more or less many are now getting paid. Dancers are getting paid for their time. It's such a wonderful trend to see happening. It's not just like for the exposure. So for me, and a lot of these professional dancers here also are the teachers at the studios. So this has kind of been a little bit of a not so secret refocus for me of like, well, let me continue to lean into the adult performers and make kind of penetrate in that the teachers, because they're the ones that hopefully will continue to advocate and try to convince Miss Debbie that it's time to bring in some health and wellness. And but yeah, it's tricky.
Yeah, and I've definitely had a lot more opportunity with the dance teachers, whether it's, I always have presented for years now for the Colorado Dance Educators Organization, or I teach at the University of Northern Colorado for a dance educator master's program that they have, and things like that. And it's kind of that same idea of like, let's just educate who we can, and those people who are in some sort of teaching or mentorship role or leadership role or anything like that can then help it trickle down, and help start to affect some of the culture wherever their local spot is.
Exactly. Yeah, to me, that has sort of been the most, at least, successful way that we've been able to get the message out at this point. And I do think I am hopelessly optimistic that there is a sea change. These conversations are happening. There's greater emphasis on this. You kind of like can't get away with, well, some still are, but with like the emotional and some of the abuse habits that studios, not to no fault of their own. It's just, copies of copies of copies. And so I feel a shift, and I'm just here to ride that wave and really, it's try to really continue to make this a top priority.
Yeah. One of the things I've also noticed too, for several years, I've been setting up shop at some of the swing competitions, and I'm part of that community because I'm also a swing dancer. But, I've become such a staple at some of those events that now I'm staying super busy. This past weekend, I actually was at one and had dancers saying, "Oh, we're so excited that you're here." I actually had one that said, "I am so thankful that they're recognizing that we're getting treated as athletes."
Yes.
And when they said that, like, I almost started crying, no joke. When I heard that come out of their mouth, I was like, yes, that's exactly what we're going for here.
Exactly.
But now it's like, if I there was one event that I missed a couple of years ago because the schedule had changed last minute or something and I wasn't available. And I was getting messages from people, are you going to be there? No, I'm sorry, I can't be there. And it has become such a thing now to have that, to expect that I'm going to be there or bringing colleagues to be there with me.
Right.
And it's cool to see that in that community too.
Yeah, love
Um,
that. It's so
just by being really stubborn and keep showing up, even though the first several times I hardly had anybody come by.
right.
But it's been fun seeing that shift there too.
Yeah, no, that sounds great. I mean, regardless of the genre of dance, and I mean, I even say this for actors, sometimes there's hesitancy from a theater to put PT on a play,
Mhm.
well, there's no dancing. And I'm like, any body that has to embody a different human body for many, many hours a week needs attention, and
Yes.
it's, you know, I, I mean, I might be biased, but again, you're an athlete. You're training like an athlete. Your schedule looks like that of an athlete. Let's
Mhm.
train like one.
And sometimes we don't appreciate, if there isn't dance, if there isn't some of that sort of thing, even costuming or
Right.
props
Totally.
or, like you said, raked stages or some of these different things. I mean, all of that puts more demand on our bodies
Completely.
and still
Completely.
needs attention.
It's one of the consultations we often insist upon is with costume, actually. And we did a production a few months ago, and it was a play, but it was based on a baseball team from the 40s and 50s. And
Mhm.
so they did bring in a baseball person. And we're in Boston, so we got all the athletes, all the teams.
Yeah.
And even with that, I still had to kind of I'm like, well, here's the deal. Yes, that's how you swing a bat, but none of you have the hip mobility to do it correctly. So we're going to do what we got, and the baseball person they brought in was correct. It's
Mhm.
these bodies aren't trained like that. And sorry, we got 1 week. So it's like we don't have the time to really do it correctly. Like we're trying to hit the ball far. It's like there is no ball. Anyway,
Mhm.
things the first thing I did when I walked into the theater during rehearsals, I'm like, can I see the show shoes? Can I see show shoes?
Mhm.
And they were flat, nothing leather period shoes. And, these athletes that were learning, they were in rehearsal, they were all wearing Nike Airs and Hokas. And I'm like, listen, can I talk to costume? I just need them to half size up all of these shoes so we have room for toe spacers and heel cups if we need, because these have no cushioning and these feet are used to a lot of cushioning. So
Yeah.
things like that. Corsets, forget it. Corsets kill me. So it's always a matter of negotiating.
Mhm. Yeah.
I mean, the costume list can go on. It's wigs, and I mean, we even had to help one of the hairdressers who was, I think she was about 4'11", and so she was working
Oh gosh.
it's like forget the actors. If this
Mhm.
woman's shoulders don't, then nobody's getting wigs. So, I need a step stool. We just need a step, it's things like that nobody really thinks of. But
Mhm.
this is what I'm really, the earlier we can get in to kind of get our eyes on some of these pieces, the better.
Yes, definitely. I remember even in high school when I was dancing, we did a ballet piece. I think it was my senior year of high school. And it was the first time that I had a very long skirt and full skirt and we were dancing on point and, it was this whole thing and trying to learn how to maneuver this thing and get some of our kicks and leg lines and whatnot with this massive amount of fabric. That was a whole thing
Whole
to
thing.
have to figure out. So I can't even imagine. And it was, relatively light fabric and all of that. I can't even imagine with some of the costuming that's out there,
Mhm.
some of the things that come up for folks.
I know. I mean, I just last night just started a production of Romeo and Juliet, and one of the actors is kind of wearing like high top chucks as part of the modern, And I mean, we spent 5 minutes figuring out how to lace his shoes appropriately so they're not compressing. Like, I mean, it's like the littlest things that nobody taught me, but just being in this position for all these years, it's like, oh yeah, let's see how you're lacing your shoes. And the actor's like, really? I'm like, yeah, really, I know, but here we are.
Yeah, trust me, after 8 shows a week,
Yeah,
you will
exactly.
notice a difference.
Exactly.
Another piece, so we've really been talking a lot about, working with the performers as part of their show, as part of their training, and that sort of thing. Another piece of this that I think we've been hinting at, but I want to just come straight out and mention
Yeah.
is just like you were talking about of how do you lace up your shoes? It's this prevention and injury reduction piece of it.
Yes.
Being able to work with folks before they've developed pain or they've developed injury or they've developed some really strange movement habit because of whatever's been going on.
Totally.
Talk to me a little bit more about how you see that within the way that you practice with folks.
Yeah. Well, I will say it's a shifting the way that we're looking at it, at least for me, is like, how can we make this better? I was trained, again, performing arts PT, a lot of the way in which PT on site for theater has been done, and for dance too. I mean, this is kind of the way it's done is anybody in the show can sign up for a 20-minute slot, and most of them expect you go to the PT room or like the balcony or the lobby and you get on the table and you get your 20 minutes of manual therapy, and maybe you get an exercise or a stretch, and then on to the next.
Mm-hmm.
And that's the way I was trained. That's the way if you go to any backstage production in New York, I mean, internationally, that's the way it's pretty much done.
Mm-hmm.
And again, I mentioned it's like we kind of already know the research has been done. Manual therapy, I'm a big manual therapist. It has its place. It's not the end all be all for most of the things that we're seeing.
Yeah.
Like your upper back stiffness does not need me to rub your upper traps for 20 minutes. I promise you that. Right. And so and in fact, just this morning before this call, I had a call with one of the directors of a theater, and I wrote up a pretty lengthy proposal. And I've been at this theater for many years now, so I feel like I was in a position to kind of like say the thing.
Yeah.
Like I have some requests, and it was essentially one of us is involved early in the rehearsal process. So we have like our eyes are on rehearsals. So we can literally see the things that are coming, and we can at that point establish and I love that you used injury reduction. That is so much better language than prevention. So thank you for saying that. So to work on the injury reduction plan. So like, a production with all heels or a lot of repetitive lifts, like we'll kind of get ahead of that and provide, a little series of exercises to get ahead of it. And with that early access, we're also consulting with costume, like I mentioned earlier. One of the other parts of that early access is actually allowing us to talk to the company about what is the emergency action plan, what is an injury versus pain, how do we process, how do we actually report an injury, what is the workers' compensation process, how do we go through that whole thing, and because I mean it's pretty wild, the lack of knowledge. I mean, the artists, why would they know? But also the theater isn't always so forthcoming with this information either. And so, I'll get phone calls from like old productions, an actor from a production months ago, and they'll reach out to me and they're like, hi, can you write me a script so I can do my workers' comp PT? I'm like, oh, that is so not how it works. So, and so so that's a big part of it. And the other part that I'm really hoping to make the norm is getting the folks at the table that need to be at the table in order to create more seamless movement of performers into the physician's office that they need, the imaging they need, the workers' comp, authorizations that have to go through with the adjusters. I mean, there's a lot of people, and being a PT, having worked in a clinic for many, many years, I've spoken with many, many adjusters. Like I know how to have that talk, and I know the workers' comp process, and even outside of performing arts. So
Mm-hmm.
I basically, that is like the outline that I'm proposing. And the call went great. I think it's happening. So that's wonderful. But that is really the vision that I have. And with that, it's, again, not just on-site 20-minute sessions, although that will still be there. It's also, I would love to implement some small group recovery
Mm-hmm.
regular basis. Again, the hard part is that they got one day off. And so to have them come to the theater on their day off is a hard ask. But if there were 2 days off, that might be easier. Or if it were virtually, we're looking to create easier access for the artists to access massage therapy, to acupuncture, to chiropractic. So not so much like, hi, do you have a name? Who can I reach out to? But kind of actually facilitating these things so that they can really just focus on what they need to focus on and kind of let us do the orchestrating, so to speak.
Mm-hmm.
And so this is, I'm reaching high, I'm aiming high, and I know it's going to take time, and I know I'm not going to get everything I want, but
Mm-hmm.
I might as well aim for it. And so,
Yeah.
I just, I think one of the big problems when it comes to this area is, and, I've spoken with a lot of my colleagues in New York, the productions that we see here often go back and forth. So we're like passing the baton often. And
Mm-hmm.
we're all on the same page. The vision I just outlined is the vision that a lot of these New York therapists also are really trying to instill, and is happening. We're like really trying to, it's happening. The problem is that the big players, the big companies that do this type of thing beyond just my little operation here and the individual New York operations,
Mm-hmm.
they're still doing that whole 20-minute bodywork centered care. And so bigger productions, the big productions in New York, the production companies that do the touring, they just don't know that
Mm-hmm.
there's an alternative, and there's not much competition in that regard. So I think there are some big barriers to kind of making this the norm of what I'm outlining, but I'm still going to try. And, maybe Boston and New York, we sort of start to change the day-to-day, like that might grow, hopefully.
Yeah. I think that is such an important idea. And again, several things that you mentioned there. When I have done backstage stuff for some of these professional companies coming through, whether it's theater or dance or whatever, it is 15, 20 minutes. And it's usually, like the ones I've done, it's been maybe 8 slots, and they're prioritizing the people who are most hurt. And so the people who have a little bit of something don't get seen.
Right.
And that's sort of their only thing. And so, yeah, having opportunities outside of that, opportunities to get them with some exercises, support them in some of these other ways, streamlining their access to care, because we already said they have one day off. Why do they need to use that day to try to
Yeah.
organize all of this?
Well, and they're not from the city. They're not from here.
Yeah.
No, it's like, it doesn't have to be that. Like
Yeah.
one of the theaters I work for is very affiliated with Harvard. It's a Harvard entity. And I'm like, listen, Harvard, Mass General, these are huge institutions. Like, you cannot tell me that we cannot somehow figure out a
Right.
way to make this more seamless. Like, come on.
Yeah, exactly. And then, I think like I heard it from somebody else in another one of these discussions in one of my early episodes, where we were talking about kind of getting in early on a production, where even things like looking at some of the choreography that they're doing and going, if your performer does this 8 shows a week,
Yeah.
we're gonna have a problem.
Oh, yeah.
Can we consider something else? Or how do I uptrain them to be better prepared for that if
Exactly.
that is what we need to do?
Exactly.
Can we alternate the leg that they stand up on to at least like give them a break every once in a while? But being involved early
Mhm.
can really make a huge difference.
Totally. Yeah. I mean, we just wrapped up a production of Gatsby here that, most of these shows that I work on, they start their rehearsal processes in New York because that's where they live. And then
Mhm.
they ship up to Boston for like Tech Week, essentially. And so I don't know if you've met Megan Wise yet, but she's a therapist in New York. We've totally talk a lot, send a lot of
Mhm.
back and forth. For that production during rehearsals, she was actually able to get in there and make some of those
Oh, that's awesome.
suggestions. And choreographer was Sonia Taye. So the fact that they were willing to listen and amend, like maybe not 8 lifts in the same direction in one piece, like maybe
Mhm.
change the direction a little bit, even. And they listened, and changes were made. And I can very proudly say we only had one injury in that whole show.
Mhm.
We got him back in before the closing. So it was, I can now put a stamp on that one as successful.
Yeah, I love that.
Yeah.
I think at this point, it is a good opportunity for the special segment on the show.
Hmm.
On every episode of Dance Med Spotlight, we have the final bow. It's essentially the take home message. We've talked about a lot of different things, a lot of different perspectives. If
Mm.
someone listening were to walk away with one piece of information, what do you hope that they walk away with?
I would say self advocacy is
Mm,
super important. I think often as artists, we are encouraged to just keep quiet and follow along and push and not speak up. And, there's a time and a place always. It's not always the right time to do that, but
mhm,
um, nobody knows their bodies better than themselves. And if something doesn't seem right, it doesn't feel right, it's probably not, and you're not alone. And so it may not be like you may not feel comfortable speaking up to directors or, a lot of folks have agents. But as clinicians, we are, first of all, we're mandatory reporters.
mhm,
And so believe it, we are looking for those things that would be considered abuse. And if we see it, we're going to say something. But we're also super safe. We are all sworn by the HIPAA oath. We're not going to tell anybody if you don't want us to. It's like, to
mhm,
me, advocating, to whomever you feel comfortable with, but at the very least, your PT, your healthcare provider is a super safe person to communicate. And so often, as the PT, because I don't have the authority often in a production to make big changes, but I can encourage and give language to artists to speak
mhm,
to company management or the producers or whomever actually can make a shift and a change. I am so adamant that that is such a key piece to these changes that we've outlined, that if it doesn't
mhm,
come from the artists themselves, then I don't think any of these changes we're really trying to instill will really manifest.
mhm. I agree 100%. I love that. And I mean, that's something that I talk a lot with my dancers about
Mhm.
and the dance educators that I work with of like, how are you showing up as that safe person where they don't feel afraid to come tell you that something hurts or that they're concerned that something's going on or whatever.
Yeah.
Um, yeah, there's so much opportunity there for sure.
Normalizing is so important to me, right? It's like,
Mhm.
I think with social media, we're all kind of looking at like the top 1% of people's experiences and their, and it's just not reality. Like,
Yeah.
it's so not reality. And so the more we can normalize, like, no, not every, jeté is going to look like that, or not every day is a great day. Like, it's okay to have off days. It's, also okay to take time off. Like,
Mhm.
a month off is okay. That's a whole nother talk, but,
We need another episode for that.
I know, right? But, I think continuing to have the conversations and normalizing these things is just so critical.
Definitely. The last thing is the shameless plug.
Yeah.
This is your opportunity to talk about anything that you have going on, anything that you want to share with the audience. So the floor is yours.
Fabulous. Well, I think the thing that to me is super, super important, like I mentioned earlier, is that more and more clinicians that are interested in doing this work have the mentorship to do it, because we're not really taught it in PT school. I mean, hands-on work, let alone performing arts work, strength and condition. I mean, none of this. It's been a hot minute since I've been in school, but I don't think that has changed tremendously. And so the value of having another clinician that you can work with to show you the way, help create connections. So, and like I mentioned, the collective, one of the big tenements is now this mentorship program. And I cannot tell you how amazing it has been to see therapists who, like, I want to do this, and, like, are just in a clinic. And now, it's like 3 or 4 of them have their own practices, and they're developing their own market, and to be a small part of helping therapists figure out not just this general area as their niche, but how specifically they can lend their expertise within this niche. That has been, like, incredibly thrilling. And, whether it's just you want to be a clinical expert, or although, again, and maybe time for another conversation there, or a entrepreneur, um, it's been so thrilling to allow all of this experience I've had to sort of work in a different context.
Mhm.
And again, if I never work a 4 to 7 shift at a theater, I think I'd be okay.
Right.
But to provide the opportunity to other clinicians to be in the theater or to be in the dance studio, that has been amazing. And so I suppose my plug, and I've worked with folks all over the country. I've actually worked with folks in Canada and Mexico also. I've had to learn some different PT laws in those regards, but
Yeah.
I have openings for more mentees, and it's a 6-month program. And it's a very individual pathway. So for any other clinicians out there that are looking to figure out how to kind of put themselves into this world in a way that both supports their individual goals, but actually really still fills a hole that I know exists, that I've seen, and I just haven't had the time to fill the hole myself. That is definitely, I'm throwing that out there, that I'd be super thrilled to work with more folks that are looking to figure that piece out.
I think that's such a tremendous opportunity for PTs who want to get into the dance or performing arts space, because exactly to your point, and I teach in a PT program. We don't learn how to do a lot of the things that are very specific to the performers that we're working with. And it's things that we just figure out on our own. We lean on our own experience if we've
Make
been a
mistakes.
performer, or we find someone who can be a mentor and can help guide us through that. And so having an opportunity like this, where it is that really dedicated mentorship opportunity, is amazing.
Yeah, no, it's who knew that would be such a good use of our our PT experience, but it
Mhm.
really has. I feel like a proud mama, know.
Yes. Well, Melissa, thank you so much for your time today. This has been a great conversation, and it sounds like we have opportunities for like 5 more episodes. So,
No, reach out for sure. I can chat.
love it. Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.